Hello, and welcome to today's webinar on using digital mapping technologies during the COVID-19 crisis. This webinar is part of the Grand Challenges for Social Work webinar series through the Harness Technology for Social Good Network. My name is Kira Silk, and I'm the director of the Grand Challenges for Social Work initiative. I'm going to play a brief introduction from Stephanie Kosner-Berzin, who is one of the co-leads for this particular Grand Challenge network.
My name is Stephanie Kosner-Berzin. I am the Dean of the College of Social Sciences Policy and Practice at Simmons University, which contains the School of Social Work. I am a co-lead for the Grand Challenge, Harness Technology for Social Good, which is sponsoring today's webinar. To kick us off, I wanted to provide a small bit of background around our Grand Challenge and why, in fact, we brought folks today together for this webinar. The Grand Challenges effort was launched about 5 years ago to bring social work together as a field in order to be able to look at what are the primary challenges for our field over a 10-year period for which we could make meaningful progress. There are 12 challenges that cover topics that include some particular social problems, and then our challenge, which is really one that's more related to the field more globally. Our challenge was designed as harnessing technology for social good. And the goal was really to begin to get social workers on a path to think about transformative change that occurred because of technology and how it would fundamentally alter our practice. The challenge is made up of two distinct groups, one that focused primarily on practice and how social work practice would fundamentally change as a result of technology, and the other group that was focused on big data. Why we came together was that we recognized as social workers, while the world was moving incredibly quickly in terms of information communication technology, but it was fundamentally changing access, changing communication, changing where people receive information. The field of social work had been slow to move forward in this progression. We feel there was an opportunity to really put time and energy toward bringing the practice forward through education, through research, through training. I'm just going to highlight for you a few of our main goals for what we hope to accomplish over the decade for which the Grand Challenges were designed. We're really interested from a policy perspective on opening up access, both around internet connectivity and practice across state lines, telehealth being one of those topics. We're interested from a policy standpoint around data linkages and sharing. We're interested in data issues around how, in fact, we could train and attract social workers who could work with big data for social good, and how, in fact, we could use new technology-based interventions for practice. We wanted to make sure social workers were, in fact, controlling our destiny for how mobile apps and gaming and data would be used in practice. We also recognize that this is not the place for which we're the master of the domain, and instead that we hoped our Grand Challenge would begin to open up conversations between our profession and other sectors that are deeper in this work. There's already been a lot of work which the Grand Challenges have been part of in thinking about curriculum and pedagogy in this area, and we've been thinking more about how, in fact, we expand data access. This webinar is part of a series that we're beginning to host, and it's really part of that primary goal of how do we, in fact, develop, train, and retain a stronger group of social workers who are interested and more conversant with data and technology. Topic. Thank you so much and welcome to everybody.
With that, I will turn it over to Dr. Tom Felke, who will lead us through today's webinar.
Well, good afternoon, everybody. My name is Dr. Tom Felke. I am the chair of the Department of Social Work at Florida Gulf Coast University. I am happy to be here as part of the Grand Challenges to talk about using digital mapping technologies to inform about COVID-19. My plan for today is to give a little bit of an overview about geographic information systems. I'm not going to go too far into those, but I will talk a little bit about those. But I really want to spend a lot of time talking about how geographic information systems, digital mapping technologies are being used currently to inform about COVID-19. There's a lot of different ways that information is being shared. And I'll primarily use the example of Florida and both what our state Department of Health is doing, as well as what is being done in our department, so that we can really give you a sense of what this looks like and how easy it can be to use some of these technologies for your educational purposes, whether you're working in a classroom with students, for any type of research that you may be doing, or even potentially in your practice work that you do. So obviously, we are talking about the grand challenges, and we are looking at the grand challenge for harnessing technology for social good. And this is really, I think, a great way to look at how technology can be used in this pandemic in more ways than just displaying case data, which I think has been a major driver for a lot of our departments of health, and also for what we see coming out of different government sectors. But there's a lot of ways that we in social work can utilize digital mapping technologies as a means for also disseminating information to individuals who may be impacted by this crisis as well. So we will talk a little bit about that as we go through. So to give you a little bit of a background, because I'm not sure what everyone's uh, informational level is with geographic information systems. And I am going to bounce back and forth. At times I'll talk about digital mapping. At times I'll say geographic information system. I generally default to geographic information system and GIS because that's primarily how I've come about it. To give you a little bit of hope with all of this, I am not an academically trained GIS technician. I learned geographic information systems in my very first job working at Catholic Charities in Connecticut. And that was primarily because I'm a guy from Philadelphia. And I moved to Connecticut and I really knew nothing about the state of Connecticut. I didn't know much about the area at all in which I was working. And I was being tasked with managing a $10 million grant to establish school readiness sites in Southern Connecticut. And as I said, I didn't really know much about the area, so I really had to kind of figure this out. And I knew just enough about geographic information systems at the time to begin to utilize it in my work at Catholic Charities to start to figure out where to place 2 childcare centers for individuals at the lower side of the socioeconomic spectrum and for at-risk youth, but also in areas that were currently underserved. So I collected data on transportation from the Department of Transportation, collected data on births from the Department of Health. I collected data on licensed childcare and family-based centers from the Department of Children and Families, which actually monitors that in Connecticut. And I put it all together and created a really big map, took it into my Board of Trustees meeting, hung it on the wall, and I said, these are the 2 locations where I think we should put centers based on the data. And I'm happy to say that those 2 centers were founded and they actually still operate today. So you don't need to have a high level of technical skill to get started with geographic information systems technology. If you want to get more advanced in doing things like spatial regression analysis or those types of things, then yes, you are going to have to do some investment and develop some skills in this. Now, I teach a course in this at my university. I taught one previously at the University of Connecticut, and I teach one now at Florida Gulf Coast University. And I've also started to go around to universities and deliver 2-day workshops for faculty and students at different universities who may be interested in doing some work in geographic information systems. So what is a GIS specifically? A GIS is, and as this definition says, it's basically a collection of different things. Obviously, we think about the hardware and the software that we need in order to do this. A lot of that hardware and software is moving online to the internet, and I will show you exactly a couple tools of how we can do that. Obviously, we need geographic data, and I want you to think for a second. Think about the type of data that you collect regardless of what facet of social services you may sit in. If you're a clinical social worker, if you're a case manager, if you're in child welfare, gerontology, whatever field it may be of our profession, there is some level of geographic data. Consider a basic case file on a client. We generally collect information like their home address, and that home address actually contains multiple pieces of geographic data. We have the street address, we have the city, we have the state, we have the zip code. Sometimes we even have the county in which they live. And all of that information can be utilized in some way in a geographic information system in order to visually illustrate in a spatial manner a lot of the demographic and socioeconomic data that we collect just as a normal part of our daily routines in our profession. Now, my favorite part of this definition is the next piece, personnel. They haven't forgotten about the fact that you still need people to do this. And the reason why I think that is so important is because our profession is so diverse. I always have a running joke with my students that I'm a social worker, but I'm not that kind of social worker. And I don't mean that in any kind of pejorative manner. It's just that the majority of social workers are trained as clinical social workers. I'm not. I very much operate more in the macro world. My educational background in social work is in administration, policy planning, and international work. So I always try to teach my students that it really doesn't matter where you're coming from. You just need to be able to think about an issue and a question, and then you can use a GIS to do all of the other things that you see here. You can capture and store data. You can update it and manipulate it. A lot of the same types of things we routinely talk about in any research class as we start talking about primary or even secondary data collection. You can analyze the data, and the analysis is really where it starts to differentiate a bit. We can still do some basic analysis, descriptive analysis, and inferential analysis using GIS. But obviously, the big piece is the ability to do spatial analysis, to be able to see things in their actual environmental context. So that's why I think geographic information systems and digital mapping is such a great fit for social work. Think about our overarching mantra in our profession, a person in environment perspective. So GIS technologies literally give us the ability to consider the person in their environment. And so obviously the end all be all of what we're doing in mapping is displaying this geographically referenced information. Basically, we can create maps. And we've heard the various mantras about, being able that a picture is worth 1,000 words. And I get people all the time that talk about, oh, it's so great to see what's right around me. So that idea of, literally what's in my backyard. Sometimes it goes the other way. I find that geographic information systems are a really great tool to sometimes defeat those negative versions of what's in my backyard to not in my backyard, right? That NIMBY mentality. And a lot of times geographic information systems can help us to defeat some of those ideas. Now, as you can see in the image, some of what I've talked about is there, but one thing that's missing out of this definition that's really come along in the past few years is the idea of apps. So a lot of our geographic information system tools are actually now becoming app-based so that individuals can use them on their smartphones or their tablets. And I will give an example of that a little bit later in this presentation. So what's the place of geographic information systems? As I mentioned previously, if you can think of any facet of our profession, I believe that you can find a use for GIS technologies. Jack Dangermond is the president of a company called ESRI, which stands for Environmental Sciences Research Institute, though nowadays they just like to go by ESRI. Well, Jack had this quote from one of their national conferences where he talked about how the new applications have to tap into all of the different GIS capabilities that are out there. And he ended with this phrase that we are limited only by our collective imaginations. And I honestly believe that is true. In the video lead up to this presentation, there was conversation about interprofessional and interdisciplinary use of data and engagement with other individuals. 2 days ago, I was tapped as the interim chair of the Department of Health Sciences in my college, in addition to being the chair of social work. And I'm thrilled about this opportunity. While it's likely going to be a heavy lift in terms of having to do faculty evaluations and promotion reviews, what I'm really excited about is the opportunity to engage with my public health colleagues. I actually teach GIS for public health for that program already. I think that's why they just slotted me over there. But there's really an opportunity for us to engage with other individuals. And in looking at the COVID-19 pandemic, that's absolutely true. So I really believe that there's a lot of different pieces that we can touch upon, both in our profession and with our colleagues in other disciplines. Just to give you a little bit of background to a few things using Dangermond's quote here, he talks about geocoding, routing, geofencing, and spatial analytics. Spatial analytics are kind of the piece that I talked about before. So we have the opportunity to do very basic things like buffering, which means we literally can draw a ring of a certain distance around a location to see what falls inside of that distance. So maybe we're trying to figure out how far a particular client population is from a program, service, or office that exists in an area. So that's a basic idea of spatial analytics. But going full out, we can also do things called spatial regression analyses. And I'm sure some people are having flashbacks to their doctoral programs. Yes, it is multiple regression analysis, but we're adding in space as a component of the regression analysis. We've seen this a lot in the area of migration, immigration, refugee services, in terms of a concept called spatial assimilation. The fact that individuals of similar cultures tend to aggregate together in geographic spaces. This is why we tend to have in a lot of our urban areas, places like a Chinatown or a Little Italy. So that is part of the idea behind spatial assimilation. And so you can actually look at that and analyze that through geographic information systems. Most of you probably do geocoding and routing. You probably just don't think of it that way. But if you have a smartphone and you have a mapping application on it, you've undoubtedly found directions from your current location to some location you want to go to. And that is exactly what we mean by geocoding and routing. Geocoding is literally pinpoint address mapping of a location. And routing is literally getting the directions between multiple points. Geofencing is a different type of idea where you literally can set fences or you can set boundaries around different areas to try and figure out what exists within those spatial pieces. That's a little bit more technical. I'm not going to go too far into that one. And I really want to start to move into some of the other concepts. So in terms of social work and GIS, and again, I won't spend a lot of time here, but the fact of the matter is we've been slow on this. We haven't really embraced geographic information systems to its fullest extent in our profession, despite the fact that GIS has been widely used in other professions since the 1960s. We did see a sharp increase in its use somewhat recently because we have started to see more articles and presentations being produced, particularly at our national conferences. At the SWR conference, for example, there is a special interest group around GIS and digital mapping technologies. Probably the best article to read in regard to this was written in 2007 by Dr. Amy Hillier, and it's literally called Why Social Work Needs Mapping. So I would recommend that if you have an interest in this area, definitely go and take a look at that article, give it a read, because it'll give you a lot of great background as to how this can be used. We are starting to catch up, but we're really working from behind at this point. Geographic information systems and digital mapping technologies have had a huge leap forward. We've moved away from desktop applications. We are moving more to internet-based map servers and the dissemination of maps in an online environment. And we've also seen greater utilization of smartphone apps to both collect and disseminate spatial information. And so the grand challenges really provide an opportunity for the further advancement of GIS usage in the profession. So some of the quick capabilities that I'm going to show you in a minute around these technologies. Map creation is the obvious one, but I always tell my students when I teach them this, don't create a map just to create a map, right? Make sure that the map tells a story, that it actually provides something where you can let people know what is going on in their area. My two analogies for this are always, what comes first, the chicken or the egg, or the Field of Dreams mentality of, if you build it, they will come. And I utilize that with my students quite often to look at things that exist or things that are being considered for development in a certain area. I mentioned geocoding in terms of pinpoint address mapping, spatial analysis and spatial statistics. And then the last piece is data creation and manipulation. A lot of times we may not have exactly what we need with data. What's great about a geographic information system is you can take secondary data, for example, something from the US Census Bureau, and you can append your own primary data to it in order to visualize it in a digital mapping platform. So, looking at digital mapping in terms of COVID-19, what are some of the things that we can do? Well, we can visualize case data, and we've seen a lot of this, whether we're looking at positive cases, negative cases, deaths. A lot has been done around hospital utilization, and that's really become an important part as we try to promote the idea that this pandemic is something to be taken very seriously. And when we look at positive and negative cases, a lot of times people look at the negative cases and say, well, see, there's such a high percentage, we don't really need to worry about the positives. But the ability to be able to look at hospital utilization, particularly in an area like Southwest Florida, where I'm located, where there are not a lot of hospitals to begin with, that has been a really impactful use of digital mapping of this data. Some of the work that we've been doing in the Department of Social Services is actually mapping out resources for individuals who are being impacted by COVID-19. So looking at things like, where are food pantries located, including where are the summer break spots that the school districts have put in place. Also, where are testing sites located? And I'm actually going to show you how to do this in this presentation today in a very quick manner. We can also look at disparities such as health access. We also see this along certain racial disparities as well. And then other impacts. Where are individuals who are most vulnerable of being impacted by potential mental health issues, where their income or employment is going to be impacted, or where potentially they may be impacted by an issue such as food security. Now, an important piece in all of this are the ethical considerations. When we're doing things like case data, we want to be very careful with how we do this. And this actually became a little bit of an issue here in Florida as our Department of Health at the state level started talking about displaying case data by address. Could you imagine having an individual who has tested positive for COVID-19 having their home address put on a map and what type of stigma that may result in, or, you know, a much worse thing than stigma, given what our current context is right now. So we need to be very careful when we're providing this information that we are not unintentionally or even, you know, potentially intentionally harming any types of vulnerable populations. And so it's always important, just like with any other research method that you may be using, that if you're going to be displaying this type of information, you definitely want to make sure that you are getting the consent of the individuals with whom you're working. The other thing is there are some political considerations that go into play here. We've unfortunately seen situations here in Southwest Florida. We had a situation recently where our governor came out and really attempted to place blame on the increase in the positive cases of COVID-19 on migrant farm workers working in an area called Immokalee. And I went on the news to talk about this, and I kind of mentioned the fact that, you know, the governor speaks a little bit of truth when he talks about the substandard conditions that these individuals are forced to live and work in, yet he's not addressing any of those issues. He's just trying to put the blame for the positive increase on their shoulders. So the political considerations of displaying data also needs to be considered. So in conclusion with this, before I move over into some of the other actual applications of this, I believe that we're going to continue to see the use of GIS grow, particularly as we get opportunities like the Grand Challenges has extended to me to talk about these applications and their potential use in practice. We need more collaborations, as we talked about, between different agencies like social services and healthcare in order to advance the use and capability of GIS in our profession. We need more training programs. We need to get our faculty and our students on board with learning these. And then we also have to get our agencies to understand the true power of being able to use these, whether it is for funding applications or for reporting data, and really in a planful manner, figuring out where to place different types of programs and services. As I mentioned, the ethical issues need to be given greater consideration, particularly in our current political climate and context. And we still need people to write about it. I know that there are individuals out there using geographic information systems. We just need more people to get out there and write about the fantastic work that they're doing. So I am going to move out of this presentation, and I am going to move over to looking at some actual pieces. So hopefully everybody can see my screen and you're seeing something called Policy Map. Kira, can you give me a thumbs up just to make sure that's the case? All right. You do, great. So Policy Map is a great tool that I think would be really beneficial for you to start with in learning how to use geographic information technologies. Now, Policy Map does have a freely available option. You can sign up for a free subscription. And basically what Policy Map does is it aggregates data from a number of sources and then automatically visually illustrates that information in a mapped manner. So I'm going to start off. I've already signed into my free application here, and I'm just going to open the map just to give you an idea of what this looks like. So here you can see I'm automatically given a map of the United States by state. And what I'm going to do is use my ribbon here, and I'm just going to go up and take a look at all of the different categories of information that I can draw from. And from these categories, I have different subcategories that may even drill down further. Now, you'll notice that some of this information is available, but in some cases like here, there is some information that you may think is awesome, but you need to pay in order to get it. Now, the great thing is there are university licenses for this. Our university is currently in the process of getting a university-wide license for this, largely based on the work that we've been doing through the COVID-19 pandemic and being able to show just how powerful and impactful this information has been in doing a lot of the work that we've been deploying out to the different agencies and the community. So just to give you an example of this, again, I'm just going to go here to the ribbon. Let's just take a look at families in poverty, and we'll just look at all families in poverty. And there you go. Automatically, you're provided with a map. This information comes from the Census Bureau. Particularly, it comes from something called the American Community Survey, for those who may not be familiar with that data set. This is a 5-year estimate. You can see here it has the years 2014 to 2018. The American Community Survey has 5-year and 1-year estimates, and the 5-year are considered the more stable estimates because they're done over a 5-year period, and they really give us a good sense of how things look. It tells me that I'm looking at the percent of families in poverty, and it's showing me my spatial level as counties as of 2010. And counties don't tend to change all that often, so this is pretty good. And then we can see our data legend here. So as we get darker, we're seeing higher percentages of families in poverty. Now, I want you to watch something here, because to me, this is the best part about a data aggregator like Policy Map. I noted over here that we are currently looking at data by county. Well, in geographic terms, as we move through, we go down into lower geographic representations. So we started off looking at a map of the state. Then now we're down to counties. And then we're going to start to move into even smaller spatial representations. We're going to go to zip codes. Then we're going to move to something called census tracts. Then we'll get into a really discrete variable called block groups and kind of move through. And the nice thing is, Policy Map has already done this work. So I'm down here in Florida, so I'm just going to use my navigation tool over here to zoom in, and I will recenter and keep going down. And as I get closer in, obviously I'm getting more detail, but notice over here, by zooming in, I've now moved from county level to zip code level. So now I'm into more discrete geographic representations so that I can really start to see what's going on in these communities. And as I continue to zoom in, I eventually will move from zip codes, and now I am at census tracts. And census tracts are small administrative boundaries that comprise about 10,000 or so people. And so now I can really dig in. This is the county that I'm in. I'm actually sitting right about here, right about now in my office. But there are other areas of the community that I would want to look at. This area here is known as Golden Gate. And Golden Gate is a community that primarily consists of low-income individuals and households. It's primarily a migrant family population in this area. And so we're very aware of that, and we target a lot of our services in this area. And as I go in further, look at how much detail I can get into. Now I'm down at the block group level. So I can even look at Golden Gate and see what areas of this community are most impacted in terms of poverty. So you can do this with any of these different variables. There's a lot of information here. So I would definitely look at going on to policymap.com, signing up for a free account, and playing around with this information. I'm going to put a shameless plug in right now that I am currently working on a series of assignments for social work students to use to utilize sites like Policy Map. And there are different exercises that students can use to explore different areas using these types of tools. So definitely be on the lookout for those probably next year. So why did I bring you to Policy Map? We're supposed to be talking about COVID-19. Well, that's another thing that's great about Policy Map. So I've clicked on the Policy Map logo here to take me back to the home screen. And as you can see right across the top, Policy Map has aggregated a lot of different variables that are specifically focused on COVID-19. You can even see some of the collaborations that they've done with the New York Times and the Washington Post, looking at COVID-19 health risk and how COVID-19 magnifies existing health disparities in communities of color. So they've really moved beyond the idea of just reporting on COVID-19 case data and have really started to look at some of the other impacts that come along with it. But if you click that link at the top, it brings you into their COVID-19 area where you can start to look at some maps that they've designed that are specific to the COVID-19 pandemic. So you can look at these different areas. Where are populations vulnerable? Where is it peaked? Unfortunately, that would be where I'm at. We're called Florida. Communities that are going to require greater hospital capacity for severe cases. Who's missing out on telemedicine during COVID-19? So there's a lot of really great data that is targeted specifically to this COVID-19 crisis that is available at your fingertips for free. So here I can look at the same type of ribbon as I had before. So if I want to look at high-risk populations, I can look at them by underlying health conditions. I can look at it in terms of homelessness, which may be a variable that we absolutely would want to take a look at due to our work. And so they have information from housing and urban development based on point in time estimates. Now, one drawback is, as it is with a lot of what we do, it's the best available data. So this is the point in time homeless population estimate from January 2018. May not be the most recent information, but it does give us a really good idea of what we can expect in our different communities. So again, I would highly recommend coming into Policy Map, creating a basic free account for yourself, and getting familiar with how this works. Can you do analysis with this? No. But what you can do is some work in getting to understand your community. And if you are an educator, you can definitely get a look at your students and let them to know what is going on in the communities that potentially, they're going to be starting their careers or actually having their professions in. Now, I want to switch over to a different version of this. And I want to show you an example of how this is being used in Florida. So this is the Florida Department of Health website. And what the Florida Department of Health has done is it's put together a lot of different information and it gives some statistics, but they kind of realized that this wasn't the best way to deliver this information. So what they did was they created a dashboard. And this is the Department of Health dashboard for the Florida Department of Health. And as you can see, yes, they've done some targeted data, but they also included a map. And the map in the center coincides with the information that we see down here. So we can look at testing, we can look at cases by county, we can look at cases by zip code. Now, this is one that I had a little bit of a freak out about, because when this was first published and our news media figured it out, they turned around and they said, wow, look at Immokalee. Remember, that was that area that I mentioned where they said they're really contributing the most to this. Well, that's actually not true, because when you look at these cases by percentage of these areas, this changes. So just like with anything else, it's all about how you present the data. Immokalee is a huge area that is actually sparsely populated. So here you're just looking at overall case numbers. But if you looked at the case numbers in terms of percentage of population, this map would actually reverse in a way, and you would see much more happening out in this region than you actually do see here. Hendry County, in addition, this is primarily a rural county. There's not a lot of homes out there, but testing has been targeted in these areas because it was more efficient to do, because they were these very targeted geographic areas. So again, with anything else, and getting back to that idea of ethics, it's very important that we consider how the data is being presented. So the last thing I want to show you is the work that I've been doing. So what I've been working on is a little bit of what Florida Department of Health does, but I've also been doing this in terms of looking at resources. So this map that you see here is actually the same exact map that you see here. ArcGIS is an online tool that allows us to create these dashboards. It's put out by that company, Esri, that I mentioned earlier. And this really allows you to go in and create these different things. So what we've done is we pulled the map directly from Department of Health and placed that in our own dashboard. And we can look at cases by county. We can look at testing. We can look at some different statistics. We even linked to the center, the CDC, the Centers for Disease Control and Prevention, so that we can see their information as well. But then what we did was we put in our own information. So we listed things about testing sites and mobile testing. We put in things about the summer break spots to feed school children. We put in information about funding opportunities. And then the last thing we did was we created this tool over here. So working with our local food banks, we went out and got information about all of the mobile food pantries and the summer break spots that would operate during COVID-19. And we mapped all of those out, and this was a very simple process to do, believe it or not. And now individuals can type in their address. So I'm going to type in my university address, and I can select that, and it will show me all of the locations that are within a certain area. Right now I'm at 10 miles. And if I pick the closest one, it will give me the information about that site. And I can also get directions to the site. So this is that process of geocoding and then routing, so that I can figure out exactly where I can go to obtain the resources that I may need. So this is the way we've been doing this in Southwest Florida. There's a lot of different ways that these technologies can be used, but I really just wanted to give you an overview of what this could look like for your different types of work. So I'm going to stop sharing my screen. I know that we're getting a little short on time, and I want to make sure that we're leaving some time if there are any questions from anyone.
So while we wait for some potential questions to come in, I want to just first of all thank you, Dr. Felke, for giving such a useful and informational presentation. I think folks are really very interested in what you've shared, and there's been some excitement that they'll get to watch the recording as well afterwards to go back and see some things you shared early on. So if folks have any questions, feel free to submit them through the chat or the question and answer function. And while those come in, I will share some future webinar information on the screen so that folks have that at their fingertips. One question that has come in is whether it's possible to use GIS to map minority-owned businesses and services.
Yes, it's absolutely possible to do that. So the policy map program that I talked about actually has information regarding minority-owned businesses built into the system, and absolutely could go in. So you can go in and just create that map automatically.
Another question on making GIS application relevant to both micro and meso social work practice.
Yeah, so again, going back to that idea of relevance, I think that's really up to the user, right? So I talked about this with my students that I know are going to go off for LCSW. To look, you can get data that shows individuals from who have participated in the behavioral health surveys that are conducted by the CDC, by Department of Health. You can get that information, you can map it so that you can actually find those communities. So locally here, a project that I did with one of our county departments of human services, they got funding for a crisis outreach van. And so I worked with them to target the areas that may have higher incidence of mental health issues or prevalence. And so they've been able to target their services in that regard. So I do not, as much as I tend to be a macro guy, I do not see GIS as being limited solely to macro practice. I absolutely believe that you can utilize these technologies across all levels of social work practice.
Now we've got a lot of questions coming in. One would be around how you find geographic databases.
So geographic databases are as simple as Microsoft Excel worksheets, right? So when people talk about geographic databases, that's a really fancy term for large databases that contain a lot of spatially referenced information. I'll be honest, the majority of the work that I do, that map that you saw me do or that you saw on the screen about food pantries, that was a Microsoft Excel spreadsheet. And as long as the spreadsheet has geographically referenced information, things like street addresses, zip codes, etc. Most people don't know what a census tract or block group number are. I don't utilize those either. I largely rely on the Census Bureau for that. But as long as you have that other geographically referenced information, it doesn't need to be fancier than a Microsoft Excel worksheet.
A question around how you created the COVID map in Florida and who you needed to collaborate with to create that. What type of technology skills do you need to do such a thing?
Right. Yeah, so here's the fun thing. So going back to Microsoft Excel, if you know how to use Microsoft Excel, you can use GIS technologies because GIS technologies, as fancy as they look, because that's what we all focus on, they are very much a data-driven product. So really what you're doing is you're making a connection between two things. You're taking a map that obviously has geographic reference to it, and you're taking your data that has to have geographic reference to it, and you're joining them together. And that's literally what allows you to see the data on the map. And with ArcGIS Online, it literally has gotten much simpler than when I started using this technology, to where all I need to do is create my Excel worksheet, upload it to my ArcGIS Online account, and then the software does all of the work. It geocodes all of the points for me. It references all of the information, gives it points, gives it color, all of that type of thing. So it actually has gotten much easier than it used to.
Thank you. We have a question around ethics and when or where a client must give consent.
So I think anytime there's the idea that you are going to geocode a client address, that gives me the willies, right? So a lot of years ago, there was an article and a presentation that was done around mapping suspected child abuse in a particular neighborhood, but they mapped that data only among African American and Hispanic Latino families. So that gave me a lot of pause, because what the individuals did in that case potentially was create a map that with some relevant, with some confidence, I potentially, if I got my hands on that map, could have gone to that neighborhood, walked up to the door, knocked on it, and if the individual who answered was African American or Hispanic Latino, I could have turned around and said, well, you must be the individual who abuses or neglects your child. That can be very dangerous. When I worked with the Department of Social Services in Connecticut, and I spoke to our commissioner about this, we made an agreement that we would never put data lower than a zip code level, because the political climate at the time in Connecticut was not very beneficial for individuals in the social services. So we wanted to make sure that we were displaying the data in a way that was useful without putting potential issues in place for client populations, particularly at-risk and vulnerable populations.
Wonderful. We have two questions that are sort of related. One around if there are any syllabi available, particularly online and accessible for teaching MSW students GIS applications, and also your thoughts on its connections, GIS application connections to CSWE's educational policies and accreditation standards.
Yeah, so is there syllabi? There's a few, there's not a lot. There was a study done a few years ago that showed there was only a handful of schools across the country who were even delving into this topic in social work. As I said, I teach it as an elective course, so obviously I have a syllabus on it. I am more than happy to share that. Beyond the syllabus, what you really need is the text to look at. And so I have recommendations on text to utilize in this space as well. With regard to the educational policy and accreditation standards, I'm not exactly sure the context for that question, but here's an example that I'll give. When we went through our reaccreditation process or reaffirmation process for our department, I actually used GIS to map out all of my field education sites within a 5-county area, and then categorize those according to how CSWE categorizes out different areas in their annual reporting, for example. And our site visitor was super impressed with that. And we utilize that as a tool in helping to place our students across, again, a 5-county area. So it's a really great visual tool for our students and for our field coordinator and even our field liaisons to utilize to see what's in the community.
Great. Well, I want to take a moment to thank you very much for your time. I want to thank all the attendees who joined and for all the excellent questions that were asked. I'm going to now put up the upcoming webinars so that you can see those as we close out. This is part of a series, and so we have others coming up, including a sort of follow-up by Dr. Felke in a month or so. So again, I just want to thank you, Dr. Felke, for participating in this webinar series, for providing this kind of unique perspective within social work and showcasing of a great use of technology within our field. If there are no other questions, I just want to thank you all again for your time for participating. You will again receive an email about 24 hours after this with a link to the recording, as well as links to register for future webinars. And we hope to see you all there. With that, we will close out the presentation.